What is uterine artery embolization and when is it needed?
A uterine artery embolization is basically interventional radiological procedure or a fluoroscopic procedure where we enter into a blood vessel. We reach to a desired blood vessel, that is uterine artery, through a small pipe called catheter and then microcatheters. And we inject particles and we occlude the uterine artery. So uterine artery embolization is a procedure done to reduce the size of uterine fibroids, because uterine fibroids are vascular structures where after embolization the size of the fibroid regresses slowly, and the main complaint, that is bleeding or the pressure symptoms, reduce over the time. There are other indications like uterine AVM, uterine AV fistulas in patients postpartum cases or post DNC cases where we can see arteriovenous malformations or increased uterine bleeding. There are certain things called as enhanced myometrial vascularity. In those cases, with the embolization, we can reduce uterine bleeding.
What are the advantages of uterine artery embolization over conventional modality of management?
From conventional treatment as hysterectomy, we have moved to minimally invasive treatments like embolization. Embolization is minimally invasive method where we can reduce the blood supply of uterine fibroids without having any suture, any cut to the body. So advantage of embolization is it is minimally invasive treatment where we can preserve the uterus, we can preserve the function of uterus, we can reduce the complications related to hysterectomy, and patient can recover within very short span of period as compared to the conventional treatment.
What is your clinical experience on the results and the present literature evidence of this procedure?
There are many cases where uterine artery embolization helps to save the uterus, to save the life of the patient. ACOG 2021, that is American College of Obstetrician and Gynecology 2021 Practice Bulletin, they recommend as a uterine artery embolization as an interventional radiological procedure where this treatment is recommended who desire to preserve the uterus, particularly in patients where there is a contraindication for the surgery and the reproductive outcomes are expected. NICE UK uterine artery embolization for fibroids 2010 recommendations. Uterine artery embolization is efficacious for symptom relief in short and medium term for substantial proportion of patients.
What is radial approach and how is it beneficial for the patient?
Radial artery approach is much better than femoral artery approach because the compression and the bleeding post procedure is very minimal. The risk of bleeding, risk of hematoma is more in femoral artery access where it is very minimal in radial access. There is no need of immobilization, which we advise for 6 hours post femoral artery approach. In radial artery approach, there is no need of immobilization. So patient's post-procedure recovery is much better. This is advantage for the patient. Radial artery approach is preferred over femoral approach.
What is your message to the general physicians for patient management in their OPD?
Post-embolization syndrome is represented by fever, malaise, and pain. It is self-limiting. It subsides within 48 to 72 hours. Basic anti-inflammatory medicines are sufficient. Pain management is very important after embolization, so we should give adequate analgesia to the patient.